Hello, everyone. My name is Brian Costello. I'm the Berkeley County Emergency Ambulance Authority EMS Director, and today is our very first episode of EMS Talk. The subject that we want to talk about today is why did my ambulance fee go up? The hope is that by providing you this briefing and showing you the information that you'll understand that, hey, this is how the Ambulance Authority is funded, this is what we do with your money, and hopefully by doing this, you'll understand a lot more about how your fee works and the overall funding of the ambulance service in the county. This picture here, we've come a long, long way in the Ambulance Authority. From the 1960s that you see there to the current ambulance that you see in front of you. The Berkeley County Ambulance Authority was established in 1988 to supplement emergency medical services in the various Berkeley County volunteer fire stations. At its origin, BCEA operated one ambulance that was staffed 5 days a week, 12 hours a day, out of one station in the center part of the county. They responded to the medical emergencies to assist those volunteer fire departments with their EMS needs. Throughout the years, however, as the county grew in population, BCA continued to grow as an organization. I believe it was 1992 the BCA began to staff a single ambulance 24 hours a day, 7 days a week. At that time, they saw the need to increase. What we saw was our volunteers began to drop off. They had families, they were working multiple jobs. So ultimately, we had to backfill that void with paid staff. So that, along with the changing requirements in EMS, really changed the landscape on what we do today. So currently we have 7 staff crews throughout the county. 5 of these crews are on 24-hour shifts. There are 2 additional locations that are staffed 12 hours a day, peak hours, what we call it, from 9 a.m. to 9 p.m. We also have a duty officer that oversees those guys and runs and assists them with calls. On this slide here, we show how the ambulance service fee has changed throughout the course of the years. As you can see, in 1975, the West Virginia State Legislature adopted a code called the Emergency Ambulance Service Act that basically dictated to the county governments that they had to provide emergency ambulance services to the citizens that lived in their communities. So Berkeley County was able to do that through the volunteer services for a number of years. And in 1988, those volunteer services came back to then the county commission and said, look, we are stronger united together versus multiple independent agencies. So they requested that an emergency ambulance authority be established to help them recover revenues for services and things that they provided. And this would also allow them to begin to impose a special ambulance service fee ordinance, which they did in 1989. And as you can see on this slide, there has been a number of changes throughout the years. In 2001, there was a $10 increase. 5 years later, there was a $15 increase. And 5 years after that, which was 2011, a $10 increase. And then you see an 11-year gap to 2022, where the Berkeley County Council just recently increased our rate from $60 to $110. Now that $110 is being phased in over 2 years to where for 2022 you're going to pay $85, and in 2023 it'll begin the $110. Now the hope is this increase not only covers the gap of the last 11 years, but also carries us into the next 5 to 10 years without having to raise that fee. We are also looking at other things, as you know, by the councils requesting that we looked into a commercial ambulance fee structure. That way we can give some money back to our households. So we're currently working that, and we look forward to continuing that on September 8th, working with our businesses and local partners to figure out how we go about doing that. Here we have a slide that lays side by side the budgets of the Ambulance Authority in 2011 and 11 years later in 2022. It also tells you how those different things within the budget either increased or decreased, and the percentages that they decrease. As you can see there under the total income, the real big piece of that is that our budget in 2011 was $3.587 million. is the operational budget. And in 2022, our operational budget was $5,910,000. Now I can tell you that's, quite a big step. We've grown quite a bit, but the necessity has been there. As you'll see on a later slide, we've almost doubled the amount of 911 calls that we've had and our transports. So here on this is just a continuation of the previous slide. As you can see, we're showing, once again, more expenditures within the budget. And the one thing that you'll notice is that that $5,910,000 matches what we said we have in revenues. And that's because the Ambulance Authority works on a cash-based balanced budget. It's not that we're a nonprofit. We are a public corporation. But what we do is say, okay, if we're going to spend $5.9 million as we did there, we need to be able to make $5.9 million as well. So here again is a side-by-side comparison of the Ambulance Authority in 2011 as well as 2022. As you can see there in our call volume, you have the requests received by the 911 center. In 2011, that was 8,032. In 2022, that's 15,974. That's almost a 98% increase, and that's in that time frame. That's quite a lot. And as you come down, you'll see the number of units in service. We've really only increased by one advanced life support, one basic life support unit, and then one 12-hour advanced life support unit, covering double the amount of calls. So that in and of itself tells us that, hey, we're on the cusp of continuing growth. We need to continue to add more services. And that's what we're going to do. With this increase in the ambulance fee, we're looking at bringing at least 2 more basic life support units online. Hopefully that'll happen around the February-March timeframe of 2023. As you can see there, our full-time staffing has increased. We went from 29 full-time field staff in 2011 to 47 in 2022. We've had to increase our office staff, which those folks not only process your fees, but they also process the ambulance billing forms for service. And then we've been very fortunate to have one employee that retired that asked to stay on as a contract biller, and she does that from home, as well as one other contract biller off site. So that allows us to have that staff with not having to grow in a very, very small office space that we have here. You can see in the field, you'll notice that our part-time staff was reduced. This was primarily due to COVID. Many of our healthcare providers worked full-time for other EMS providers, and their company said, look, if you're working in a part-time status and you become positive for COVID, you put your full-time job in jeopardy. So we never really recovered from that. The other thing is we had many healthcare providers that once we hit the pandemic said, you know what, this probably isn't the career choice for me. And they decided to move on to other careers. So we saw some of that happen as well. Moving down under our costs for what it costs to crew an ambulance, that's just to put the butts in the seat. As you can see in 2011, it was about $138,000. And now it's up to about $169,000, almost $170,000 to put those same 2 people in a seat. We didn't have basic life support units back in 11, so that's a fairly new number for us. And then you get down into the cost of the vehicle. This is a big one. We all know what the cost of living and the consumer price index has done, but this really tells a tale. When you go from $126,500 just for an ambulance up to $250,000 for an ambulance, that's quite an increase. So just think about that when you look at, where is this money coming from? Where is it going? And as we talk about what we're doing. So on this slide here, what we have is a look at the current census from 2010 to 2020. And as you can see, Berkeley County has grown from a little over 105,000 to over 122,000 in that 10-year window. And we know that from 2020 to 2022, it's grown even more. More businesses here, more people moving here. We can tell it in our call volume for the 2021-2022 that our services are being taxed even more. So we believe that number right now is probably setting somewhere around the 127 mark, but it's still climbing, and we foresee that there's no stop. So why did we say on our last slide that we believe there was no stop? Well, here is in fact an employment growth forecast for our area done by West Virginia University, WVU. And as you can see, the dark shades there is that growth between 2010 and 2020 that we saw on the previous slide. But what you see in the gold is that Berkeley County is planned to continue to grow at 2% per year over the next 5 to 6 years. So this is going to be an astronomical amount of people coming to our area or working in our area between the hours of 7 a.m. and 5 to 6 in the afternoon, which is always the busiest times that we have in our EMS agency. So now we want to get into the meat and potatoes of things and begin to talk about how the insurance and patient billing works for the Ambulance Authority. Then we're going to talk about how the ambulance fee works. And then we're going to bring these two pieces together and show you how both are very integral in the sustainment of EMS in Berkeley County. If I can get you to focus at the 2020-2021 numbers, as you can see, there's fiscal years 15 through there. But if we're looking at that line straight across, you'll see that the Berkeley County Ambulance Authority did about $5.288 million in services to the citizens in Berkeley County in 2021. Then the red numbers that you see to the right, I think any of us that has ever gotten that EOB or explanation of benefits from our doctor that says you saw the doctor on this day, the doctor billed us this amount of money, we wrote off this amount, we paid the doctor this, and you now owe that. That's what they call a contractual allowance. Well, the same thing happens in the EMS ambulance business. Is we did $5.288 million, but the insurance company right off the bat says, hey, if you want to do business with us, then you got to agree to take lesser than what you charge. What ultimately led in 2021 to a write-off of the Ambulance Authority of $1.875 million. So that left about $3,412,000 on the bone. However, as we know, here in Berkeley County, we have that, we have that household fee that allows for that BLS trip with no patient responsibility if you've paid your fee and your fees are current and up to date. So we wrote off about another $371,000 in those kind of debts, and about less than 0.5% of that is due to bad debt. People, claim bankruptcy, can't afford to pay, they're indigent, they don't have the financial means, and they apply for an exoneration. So that moved us down to where our total amount of recovery out of that $5.288 million was around $3,041,000. So as you can see there in the next column, the total annual write-off was $2.247 million. Okay, so we collected about 58% for what of the services that we provided. So keep those numbers in mind as we move forward. I'll remind you of those going into some of the other slides. So we finished talking about the insurance piece of the puzzle. Now we'll talk about those household fees. That dreaded $85 that everybody is burning my phone up about. I get it. But what you see here is the household service fee. And for 2021, we'll look at that one since we're dealing with those. As you see, there was 43,606 households that we were able to bill. In 2021, 38,271 of those households paid their fee within that 2021 year. That's about 88%. Now, there will be a percentage, usually about 5 to 7%, that'll pay in following years because we do send those delinquent accounts to collections for collections to recover. Now, if you took that 43,606 accounts and multiplied each home by $60, if everybody paid, we believe that we would recover $2,616,360. Now, what we actually collected off of those 38,000, where people paid there are penalty charges on that. We collected $2,671,282, or about 102% of what we had projected. Well, you have to think about your projections when you're doing budgeting. You can't project to spend more than what you think you're going to earn. So we were very fortunate in those years, but as you can see in previous years, we have a 98%, a 99%, and some a little bit different. So this is the chart where all of this comes together. Once again, we're going to focus on the 2020-2021 year, that $5.288 million worth of service. As you can see next to it there in the yellow, 2.986, that's what the insurance and the patient's collections were. And the difference between what the service we provided and what we were able to collect through insurance and the patient, the difference was $2,247,035. That's what we could not collect, either due to what I said, contractual allowance, or payments that were due in accordance with our fee ordinance, where people took BLS transports and got the free ride. Now, our household service fee collected for that particular year was $2.671 million. So that was a difference of $423,932. But one of the things that we failed to point out, if you go back and look at the budget for that year of 2022, there was $347,500 of what we call designated funds that we had to find somewhere, or hope that we exceeded our budgetary revenue source, because we needed to pay for equipment and things of that nature that we needed, safety gear, radios and things like that were needed for our equipment. So if you back that 347.5 out from that 423,932, it's really not a very big surplus, as to say. But one of the things that people fail to realize is, in any business, you have liabilities. And one thing when you're looking at the monies that you have and what you can spend and what you can put to different things, is you have to make sure that you cover those liabilities. Some of the liabilities that the Ambulance Authority has is leaves that people have accumulated. We have mortgages, and we also have loans on vehicles from time to time. Rather than purchasing outright, you have to take out those loans. So those liabilities have to be covered in case the county would ever say, okay, we're going to just disband the Ambulance Authority, and that way the county isn't stuck with that debt, but that the Ambulance Authority would be able to pay that debt off before closing out. So as we begin to close out this first episode of EMS Talk, I wanted to drop these two photos in here. These photos weren't taken by anybody with the Ambulance Authority. They were taken by independent reporters who were doing ride-alongs at different times. And as it says, these pictures tell a story. Early morning, early evening, doesn't matter. We're stressing our services thin. As you can see on the left, there's 4 ambulances and the supervisor vehicle. On the right, there are 5 ambulances and a supervisor vehicle, and we need more. The one thing we don't want to happen is like our fellow people in the UK, where they could be 500 or 600 ambulance calls behind, and it comes down to who has the higher priority ambulance call. We definitely don't want to do that. So, how do we do this? How do we make these things happen? Well, we operate our own ambulances out of 3 stations that the Ambulance Authority owns. 1 in Falling Waters, 1 in Inwood, and 1 in the center part of the county. Then we also house our units in Hedgesville Volunteer Fire Department, Bennington Volunteer Fire Department on Mid-Atlantic Parkway in their substation, and we also house an ambulance out of Back Creek Valley Fire Department in Back Creek Valley. We are in the process of conducting studies and surveys of information to determine the best deployment of future crews to either existing stations, or look at the potential to add new coverage areas to better serve ever-expanding population in Berkeley County. But the big thing is we continue to strive to provide absolutely best in patient care when we're called upon. We've invested heavily in education and our equipment that both contributes to better patient outcomes. We look forward to serving the future of Berkeley County, and as we say, emergencies happen. Our family will be there caring for yours. Thank you, and I hope that the very first episode of EMS Talk has been very informative. As always, if you have further questions, please don't hesitate to reach out and contact our office at the Berkeley County Emergency Ambulance Authority or look at us at www.bceaa.com.